Welcome to Health Vision. I'm Jackie Wolf, Associate Professor of Social Medicine at Ohio University. Fetal alcohol syndrome is the leading preventable cause of developmental disabilities in children. Last week, we talked about the symptoms and history of fetal alcohol syndrome. This week, Dr. Peggy Proudfoot McGuire, Instructor Coordinator of the Title IV Child Welfare University Partnership Program, joins us again to talk about working with children who have FAS. Thanks so much, Peggy, for coming back and talking to us again.
Thank you for having me. It's a pleasure.
Let's do a brief review for our viewers about fetal alcohol syndrome and exactly what it is.
Fetal alcohol syndrome is caused by the ingestion of alcohol by the mother during pregnancy. And there are 3 criteria that need to be met in order to be diagnosed as fetal alcohol syndrome.
We should say the alcohol crosses the placenta.
Oh yes, and the blood alcohol level that the mother has is going to be equal in the fetus.
Identical for the baby as for the mother. And the baby is this tiny, tiny little growing person.
Yes.
And so it's affected much more profoundly by the alcohol, obviously, than
Correct.
even the adult is.
Right, and often if you have women who drink excessively throughout the pregnancy, what you'll find is a constellation of features, facial features, which include issues with the eyes. Sometimes the ears can be misshapen. The teeth might be bigger or small.
I forget what it's called, but
The
underneath the
philtrum
nose,
will
yeah,
be
underneath
flat.
the nose will be flat. There's no what's
Yeah.
the word?
Philtrum.
Philtrum.
And a flat mid-face. You'll see microcephaly, small head size, micronathia, which is a sort of a pointy chin.
So very distinctive facial features.
Very distinctive.
And also very distinctive, it's not visible to the naked eye, but very distinctive brain features as well.
Oh, absolutely. And those are the central nervous system issues that affect physical and or behavioral functioning. Usually the children will be born below the 25th percentile
In weight,
and will
yeah.
be in weight and will eventually be diagnosed with mental retardation.
Now, is there any treatment for fetal alcohol syndrome in utero?
In utero, that's an interesting question. There are studies going on at this point in time. If the mother has been found to be drinking and has decided to, has found out about fetal alcohol syndrome and what can happen, they can stop.
Might not have known she was even pregnant.
Correct.
And says, oh my goodness, and that, the first 6 weeks of the pregnancy, maybe this is a college student who was binge drinking and is terrified and goes to a doctor and says, is there anything that we can do?
Well, obviously stopping is the first piece to that. We also have to consider that most women who are drinking generally don't have an adequate nutritional intake, especially for pregnancy. So we can work on that with prenatal vitamins, better diet, and there is a study that was initiated, I believe, in 2003, where the researchers were looking into the use of antioxidants and women taking these
To possibly mitigate the effects of alcohol.
Yes, possibly mitigate.
But we should say this is completely theory. People
Yes.
should not drink alcohol and think they can correct the problem
Yes.
with any of this. This is complete theory, and even so, we're talking about really what now is permanent damage, irreparable damage
Yes.
to a growing fetus.
Yes, you're absolutely correct. That is in theory only, and it is permanent and it is irreparable.
Can doctors now diagnose with ultrasound, say, if a child actually has fetal alcohol syndrome in utero?
Well, not necessarily. They can look at growth retardation with the ultrasound. There's another research study that is currently underway, I believe, at the University of Maryland, where they're looking at the mother's medical history, drinking history, biomedical markers, such as blood samples, and then using the ultrasound to take a look at the growth rate of the child and to see if it's within, 1 or 2 deviations above or below the normal curve.
Let's talk about how fetal alcohol syndrome, what does it mean in terms of a child's life? Okay, once a child has been born, diagnosed with fetal alcohol syndrome, or even fetal alcohol effect, there's a whole spectrum of disorders. We mentioned that in the last show. how do these behaviors manifest themselves, and what does it mean for a child's quality of life?
Oh my goodness, huge question. Well, to begin with, when we're thinking of how the brain is developed, it has been found with MRIs, babies who have died, autopsies, that these children actually have very small synapses, which of course the synapse is the part that connects the right and left hemispheres of the brain that communicate with each other.
So children, we know from autopsies of children who have died, children who have been diagnosed with fetal alcohol syndrome and who died, that the brain is very, very different than a normal brain.
Absolutely. Again, the synapse is affected. Usually the frontal and the rear lobes are affected, and the frontal lobe affects executive functioning, which has to do with abstract thinking. These kids are very concrete thinkers, which makes them susceptible and very interested in things like setting fires, like sexual behaviors that are inappropriate, risky sexual behaviors, and
describe a little bit what that means. If you have abnormal abstract thinking, what is abstract thinking?
Well, abstract thinking is to be able to say you might have a task. I'm working on a research project at this point in time, so I know that I have several tasks to complete this research project, and I will be planning.
And so much time to complete it, and this is what I need to do it in this order, and I need to know this before I know this.
Right, and also to be able to problem solve throughout that research project. When I run into difficulties, how am I going to solve those? That's abstract thinking. These kids are unable to process that way because their executive functioning, which has to do with that frontal lobe, and the communication between the hemispheres and the synapse is compromised.
You're talking about things that we so take for granted. Behaviors that we don't even think through. These are behaviors that we all count on that we have, that we're able to plan a task, that we're able to judge social relationships, these are things that we just take for granted in daily living.
Yes, it's how our society normally functions. But these children don't function within our normal range of behavior.
So this is devastating.
Well, it's absolutely devastating socially for the children because their behaviors, they're very impulsive because, again, when this all goes back to how the brain is formed during the development with the introduction of alcohol, and the prenatally exposed child is going to exhibit behaviors that are very related to planning, problem-solving issues, impulsivity. They become very quickly angered. They might not understand what we're saying to them. Their receptive and expressive language is compromised.
Don't think through consequences at all.
No, the cause and effect is totally gone for them. So, and also they have difficulty with invading other people's space. They don't have a sense of boundary issues. So when they're growing up and they're in grade school, and the interesting part about this is that the IQ for a child who has fetal alcohol spectrum disorders, or fetal alcohol effects as we call them, and don't have that facial constellation, can be anywhere between 90 and 120. So they might test out IQ-wise normally.
So of normal intelligence.
Yes, and actually excel in science, and can excel in math, can excel in reading, but have no idea about cause and effect with regard to social interactions. And again, they will have these issues with the receptive and expressive language.